Chapter 8, Segment 4 General Principles of Sensory Processing, Touch, and Pain. The reign of pain is mainly in the brain. Pain persists after injury has healed. Phantom limb. When a person loses an arm or leg, there is still a sensation of pain coming from the missing limb. This is an example of neuropathic pain. Neuropathic pain is pain due to inappropriate signaling of pain by neurons, rather than tissue damage. Pain can also be called neuralgia. Some of this increased pain is occurring in the cortex, but changes in the spinal cord can also contribute to the pain. After a peripheral nerve injury, microglial cells surround synapses between pain fibers and neurons in dorsal horn and release chemicals that make the dorsal horn neurons hyperexcitable. Astrocytes close by will enhance the effectiveness of synapses between pain fibers and spinal cells. The dorsal horn will become persistently active, and it will flood the thalamus with action potentials signaling pain. Chronic pain can have severe consequences on the brain. In people with chronic back pain, the gray matter in the dorsolateral prefrontal cortex shrinks faster than with normal age, averaging 1.3 cubic millimeters more per year of pain, a shrinkage equivalent to 10 to 20 years of normal aging. Vilaner Ramachandran came up with a way to treat phantom limb pain. He would have a patient who had a feeling that his missing limb was twisted, so he had the patient look at himself in a mirror, so the reflection of the limb intact appears as though he has replaced the missing limb. The patient is then asked to move both limbs by actually just moving the intact limb while watching them. Some people have reported that it feels as though the missing limb has straightened out, and that the pain diminishes. The brain interprets signals coming in from missing limbs as painful. Through visual stimuli, the brain may reinterpret these signals. Pain information is integrated in the cingulate cortex. Cingulate cortex becomes increasingly activated by a stimulus if the person expects the stimulus to be painful. The extent to which the cingulate is activated correlates with how much discomfort people report in response to the same mildly painful stimulus. People experiencing pain had both anterior and posterior cingulate activated, but when they were empathizing with a loved one who was suffering, that is, they were only experiencing the emotional aspect of pain, only the anterior cingulate was activated. The cingulate cortex is activated in people who experience illusory pain. By placing your hand on a cool pipe and then a warm pipe and continually alternating results in this sensation of pain. Pain sensation can be caused by neighboring CMR1 and TRPV1 receptors being stimulated at the same time, which they're not used to doing. So this is odd for them. Migraines. Intense headaches that usually only occur on one side of the head, and they usually regularly reoccur. Some migraines associate with a wave of neuronal hyperexcitation that spreads across the cortex, leaving a wave of inhibition or cortical spreading depression. And this wave stimulates trigeminal nerves that normally signal damage in blood vessels. Another explanation is that the trigeminal nerves release the neuropeptide CGRP, which actually does cause pain. So intervening with CGRP may actually diminish pain. Social rejection hurts too. Natural selection may have played a part in why we feel pain when we are left out of a group. In evolutionary times, we depended on each other to help hunt for food and protect us from dangerous predators. Being left out of a group at this time could have been detrimental. Several studies found that social rejection also activates the anterior cingulate cortex. The extent to which this region is activated correlates with how upset an individual is from this rejection. In a study, a group of individuals were brought to a lab and hooked up to an fMRI while throwing a ball back and forth to each other on a virtual game of catch. The other two players were supposed to be on other computers playing, but but the researchers determine if you would be included in the game or not. The fMRI showed that being left out of the game of catch bothered some people more than others. The more distressed the individual was, the greater the activity in anterior cingulate cortex. Social rejection activates the same emotional pain as physical damage, and a study found that taking the same drugs you would for a physical problem can also relieve the pain of rejection. Participants were given either a placebo or a painkiller, Tylenol, before playing virtual catch, and those who took the placebo reported having more hurt feelings than those who took the painkiller. There was also less activation of the anterior cingulate in participants who took the Tylenol before socially rejected. Participants who took the Tylenol also reported fewer hurt feelings in everyday life compared to those who took the placebo. Pain can be difficult to control. There are specific pathways that transmit signals to the brain. So why can't we just cut the axons signaling pain? This may reduce pain perception, only temporarily though. After a pathway in the spinal cord is cut, the pain is initially diminished, but it will return in a few weeks or months. The typical way these data are interpreted is that the nociceptive input from the remaining intact pathways become abnormally effective. There are different strategies that can alleviate pain: opiate drugs, placebos, acupuncture, and stress. Opiate drugs. Opium is used for analgesia, which is a loss of pain sensation, for many centuries. Opiates are derived from opium and cause an decrease in pain sensitivity. Opioids are natural opiate-like substances in the brain. The brain modulates pain by releasing a substance that works in a way that same way that exogenous opioids, like morphine, would. There are three classes of endogenous opioids: endorphins, enkephalins, and dynorphins. And there have been several opioid receptors discovered, all designated with Greek letters. Mu receptors are mostly affected by morphine. Analgesics that work on mu receptors are more effective in men than women. Drugs that work on kappa receptors are more effective in women than men. And kappa receptor specific drugs are especially effective in women with red hair. Melzik and Wall, in 1965, suggested that pain is subject to many regulating influences, such as some that can close spinal gates controlling the flow of pain formation from the spinal cord to the brain. Placebo is an inert substance like a sugar pill or other treatment that has no obvious direct physiological effect. In the study, patients were told they are getting an analgesic after having their wisdom teeth pulled, but were not told what kind. Some people were given a morphine-based drugs, while others received saline solutions. 1 out of 3 patients given the placebo experienced pain relief. Researchers gave the opioid antagonist naloxone to other patients who were also administered the placebo, and these patients did not experience pain relief, implying that the placebo relieves pain by causing the release of endogenous opioids. Functional brain imaging indicates that opioids and placebos activate the same brain regions, and that both treatments reduce the activity of neural regions responding to pain, including in cingulate cortex and spinal cord. A consistent finding is that people experience pain relief from placebos, yet others do not. People who have a greater activation of brain regions with opioid receptors find that the placebo is effective, which further implicates endogenous opioids in the placebo effect. Environmental cues can also enhance the placebo effect. For example, people find that larger pills are more effective than smaller pills, or that the more expensive a medicine is, the better it is, or that doctors and nurses that assert that that this treatment will work, if they're wearing a white coat, that the treatment will actually work. Acupuncture. The earliest description of acupuncture as pain relief is at least 3,000 years old. In some acupuncture procedures, needles are manipulated in one position, and in other procedures, the needle is delivered an electrical or heat signal. Only some people receive relief from chronic pain via acupuncture. Part of the pain blocking element of acupuncture is mediated by the release of endorphins, because when an opioid antagonist, naloxone, is administered prior to acupuncture, blocks its pain control effect. Some say that you must carefully place the needles in specific areas depending on the type of pain you have, but one report on how acupuncture relieves headaches in many people found that it actually makes no difference where you insert the needle. It's also an example of a placebo. Stress. Laboratory studies demonstrate that the existence of pain control circuitry, but they don't tell us how the inhibitory systems are normally activated. Brain systems produce analgesia when pain threatens to overwhelm effective coping strategies. Stress analgesia may be blocked by the opiate antagonist depending on the type of stress, which indicates that stress activates both an opioid-sensitive analgesic system and a pain control system that does not involve opioids, but more likely endogenous cannabinoids.